Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, I'm joined by Leon Young, CEO and founder at Cogniss, and Dr. Frank Iorfino, Senior Research Fellow at the Brain and Mind Centre, the Faculty of Medicine and Health at University of Sydney. G'day, gents. How you going?
Very well. Great to see you.
Yeah, very well. Good to be here.
Good to have you on the show. Always great to have a chat with you, Leon, and talk about Cogniss. We've done some cool things this year and looking into 2026 as well, as we plan to have some of those conversations. Really looking forward to hearing how things are going on that end. But also it's great that we've got Frank here too, because you know me, I like to talk about these kind of tools and innovations in practice. And, and I know that this whole, youth mental health side and predictive healthcare is very much top of mind and important on the Cogniss side in building out these no-code solutions that can make some of this possible. So let's kind of get cracking. Leon, can you introduce yourself? Tell us who you are and what you do.
Yeah, I'm Leon Young. I'm the founder of Cogniss. The short background on me is that I've been in the no-code space for a long time. In the 1990s, I founded a company called No Code. So one of the first platforms that helped non-technical people build applications for the internet. And after selling that in the early 2000s, I wanted to do something with more impact and indulge my interest in human behavior, and founded an agency called 2 and 2 that worked with major research organizations and government to build digital behavior change solutions. And over the years, that became more and more what we're now called digital therapeutics. And we came to the conclusion that the agency model was too expensive. We built great solutions that would go out and sometimes help tens or hundreds of thousands of people and see them get switched off after a few years because they were too expensive to maintain. So that's why 9.5 years ago, we founded Cogniss with this vision of building a platform that would make it easy for health professionals and experts like Frank to build and maintain solutions themselves, but also provide infrastructure into health providers so that they can actually use these solutions, get them into the hands of people that need them.
Love it. Also love talking to people who were doing things before they had an official name. So like the no code thing, and then it became no code, and even digital therapeutics to a point, like it's those.
We didn't know it was called digital therapeutics. And can you believe it? I actually trademarked the word no code around the world and then sold it with the business in 2001, along with all of the domains for that word. So a great regret.
Are you friends with that guy that bought a pizza with a Bitcoin? Like back in the, you can have your little regret sessions. Yeah. Good times. Anyway, but Frank, love to learn a little bit more about you and the work you do.
Yeah, great to be here. So I'm Frank. I'm a senior research fellow with the Brain and Mind Centre, and my background is actually in psychology and neuroscience. And then during my PhD, I spent a lot of time working in the youth mental health area, trying to understand more about youth mental health trajectories. How do they emerge? What is their course? And really with the goal of trying to improve youth mental health outcomes, functioning, and illness outcomes. And then but also during my PhD, I got very interested in digital mental health as a solution. I work in the health services space as well. So, realizing that health services are, under strain, reach capacity. And so became very interested in how do we leverage digital tools, technologies to scale really high quality mental health care. And so ever since then, that's going back, over 7 years ago, I've been working to build new tools and working with health services, clinicians, lived experience to try and evaluate and get these things out there in the world. And yeah, working with Cogniss has been part of that journey of getting it out there.
Yeah, nice. And I guess being in the thick of it, so to speak, you would know as well as everyone knows that in healthcare, we're very good at looking after people when they need to be looked after. And we do talk about this need for, well, how do we provide interventions before they actually become a thing? I guess one way to determine if to help that concept of, I guess, preventative healthcare is to make those predictions. But tell me more about how you think about the importance of this concept of predictive healthcare.
Yeah, I think it's super important in healthcare. I mean, as you mentioned, we tend to be kind of reactive. We wait for problems to emerge, for them to get serious before we intervene, and this is especially true in the mental health case, and especially in the youth mental health area, which is my field. And this leads to higher costs, worse outcomes for people. And so really the interest for us is about indicated prevention, early intervention, which requires us to say, okay, how do we detect who is at risk for poor outcomes as soon as possible to provide more proactive care? So it's about trying to identify these risks early, and not necessarily mean that we're going to lead to high cost interventions, like give everyone kind of medications and really high cost treatments, because if we are picking up things early, it means we can start with lower intensity interventions and hopefully reduce the sort of the impacts of kind of long periods of untreated illness, which leads to huge costs to people, to their families, to society in the future. So by focusing on prediction, which isn't perfect, it's not a perfect science, but it helps us identify who should we be spending time on to try and prevent and improve their illness trajectories.
Yeah. I mean, yeah, obviously you can't look into the future, but to be able to have a better way to see around those corners, so to speak, that makes a lot of sense to me. What about you, Leon? You see this a lot too.
Yeah, and this has always been part of our vision, that we really want to help reduce the load on the health system. So how we can keep people well in the first place, how we can treat them in the home, reduce clinic visits, make sure that when they meet clinicians, it's at the right time with as much information as possible and going through the right pathways. We feel that's key to solving this universal global issue in healthcare systems of not enough money, not enough healthcare professionals, right?
Yeah.
And so we look at everything through that lens, and it's really encouraging to us now to see people creating solutions on Cogniss that are using these predictive models for particular conditions. But going back to when we first kind of did our visions and sort of slides on how we imagine Cogniss, many years in the future, we were really thinking about how the data that is collected through various apps that people might be using can be shared between those apps with consent of the patient and used to predict various health events before they occur. So we've always had this internally, we talk about holistic precision digital healthcare. And our model is very much in health systems about having a super app where they can license Frank's app or they can license other apps and give those in combination to the patient. And there is tremendous opportunity, you can imagine, if you've got a mix of wellness products and products related to specific conditions and a patient is experiencing, to start to predict when someone might have another condition where there might be that comorbidity and complications around that. And so this is kind of the sort of product that Frank is building and a few of our other customers building. To us, it's the first step for predictive health. And the second step is how we predict new diagnoses, potential diagnoses and things before they occur.
Yeah. And Frank, I'd love to hear a little bit more about how this thing works. So the thing you built, the why it exists, the how it works, and how it ties in with everything clinically.
Yeah, I mean, so our interest is in personalized mental health care. So we know that one size fits all approaches are really just not cutting it for people. We need to try and personalize care to the kinds of things that are going on for a person. And so we've been working with Cogniss to build an app, which is really, I mean, it's nothing too groundbreaking in terms of what the concept is, but what we're doing with Cogniss in terms of building out the predictive capability is quite novel, which is that we're trying to leverage the mobile devices where people can give us information to track their kind of mental health and their daily behaviors, but also leveraging wearables and this mobile sensors that are available in people's phone to learn more about people's lived experience of mental health and their behaviors at a much more detailed level than it's possible currently in kind of spread out sessions that are currently the norm for mental health care. And so the app is called Minding Your Mind, and basically it's available to people to track their mental health, their lifestyle habits to day through really short surveys and these kinds of passive sensor collection, things like step counts, sleep, and the other things. And what we're trying to do is help people understand the patterns between these kinds of behaviors and their mental health, and make predictions about, okay, when someone's sleep deteriorates, what does that mean for their anxiety in the future? And really the goal here is to, again, just provide much more personalized information about what might be going on for them, and predict kind of the relationships between variables, between the kinds of factors that are of interest, to try to provide people with much more detailed recommendations about what might work for them.
Yeah, and I guess, you're not with all of the clinical expertise and the direction that you're going, the last thing you want to be is a technology company as well. So I guess that kind of makes sense, utilizing, rather than building something from scratch with a bunch of code and having all of the tech developers in the team, being like, I get why a no code solution would make a lot of sense, right?
Yeah, absolutely. I mean, working with Cogniss' no-code solution was really beneficial for us because it meant that we could take our idea and get it into a sort of tangible solution pretty quickly with a kind of low cost and a low barrier to entry. We didn't need to hire a huge development team. We didn't need a kind of huge tech stack and go into all of that kind of pain. As researchers at the Brain and Mind Center, we were interested in, okay, let's take our idea, let's get it out there and start building it. And so being able to leverage the no-code platform was a very easy way for us to just dive in and really focus on the idea and not necessarily concern ourselves too much with the kind of development that goes along with it. But it doesn't mean the development part wasn't important. Obviously, having the kind of reassurance that there's kind of a really safe infrastructure and a really kind of secure and scalable infrastructure was important to us. And so being able to say, okay, and point to something of like, okay, Cogniss has this kind of platform that does have demonstrated utility in terms of being safe and secure to use in healthcare, that was really reassuring to us, and it meant that we can just focus on the idea and building out that solution. So it's a huge benefit.
Yeah, I'd always think about, like, on one hand, it's, I can see the benefits of having, being able to use a tool that you don't have to worry about all of the, that all those important factors of security and data and privacy, all the things that are super important in healthcare are kind of, there's much more attention to that compared to if you were just spin up a random no code solution that you could, as a consumer, which are all great, but just not fit for purpose in the healthcare side. But then I'd kind of be worried, like, well, we've got this vision for this thing. And then if it was just, here's the tool, well, yeah, we could do that. Sort of, here's a pre-built thing you can plug in and white label, but it sounds like it's more than just white labeling an existing app, right? It's kind of like utilizing the capability, but then fine tuning it for your actual use case. Is that how it worked, Frank?
Yeah, absolutely. I mean, we didn't, there are features on there in terms of like tracking certain outcomes or goal setting or habit tracking. These are things that were built kind of already. And so and this has been, me and Leon talk about this all the time. I mean, mental health is no different to other healthcare areas. Like, we're interested in the same things. We have symptoms to track, behaviors to try and track, psychoeducation materials to try and provide people. Like, it's common across all of health. So leveraging those features, those things that have been done in other areas of health, was made our job so much easier, trying to go, okay, yeah, we will take that habit tracking feature. We will take that kind of psychoeducation kind of module. So, and then we added on something that we were interested in that's now available to others too. Like, we were interested in, okay, hey, can we use the Apple Health Kit information to integrate those kinds of more passive data collection to make it easier and reduce the burden for people? And now that is available in the platform and can be used by others, in other areas of health as well.
And that's been core, I should say, to the genesis of the whole product. So it's not it's not one of those sort of templated products where you just change a few things. It's 180 odd components that you pick and choose from that have the functionality and the user experience in each of those components is kind of done for you, but then you configure them and they work together in an event model so that they can be triggered for anything to happen at any time based on any data that's collected. And the way that we built those is basically through commercial demand. So for our first 6 or 7 years, until we got to the point of hitting our vision of being almost as easy as Canva to create these sophisticated solutions, we got there by customers paying for us to build a component that we would build in a generic way, and the agreement was, well, we'll do this for you, but it has to be something that everyone can use afterwards. And so that's how our development pipeline works. And people can still build things outside of Cogniss, and they can make little plugins that drop into it. But when we have, lots of people talk to us about, Google and Apple Health and things like that, and we wait until someone says, well, it's worth enough for us that we'll pay to build that component, because then we know there's real demand for it. And as soon as we do that, you suddenly see all these other people pick it up.
And I think about unrelated examples, but I'm sure it came up in a previous podcast episode. It's kind of like if you were building it, particularly if you're a clinician, you had a really specific use case that you wanted to address for your cohort of patients. You're not necessarily so interested about, hiring a bunch of technology, the developers and managing a full-blown build out like that. But if you already know, like if you're building an app generally, it's not like you're going and you needed to do mapping or like navigation or wayfinding and things. You're not going to go out and map the entire world and then build your own map component. You're obviously going to plug into like a Google Maps or an Apple Maps or something like this. So there's all these plenty of other use cases where all the hard work is kind of already done, but then you can then utilize the capability. That's how I kind of think about this. Why reinvent the wheel 100 times?
Yeah, and I mean, and it still goes on too. Like, in the digital mental health field, like everyone is building, their own app, their own this, and it's so much replication of features of things, and especially in the research world where budgets aren't necessarily high, and so resources are constrained, and so being able to leverage, I mean, we're not reinventing the wheel every time. We can leverage things that have been created already and apply it to our specific area, which is hugely beneficial.
And there's a huge problem too with people building these sorts of solutions from scratch if they don't have the direct channel to the patient or the end user, which is they then need to go and sell it to a health system or a health provider of some sort to go out there, and there's no way you can do that generally with a point solution. And this is why health systems are not using these types of digital therapeutics much at all, and they're generally only using them for things like sleep and very general mental health where there's huge scale, because the cost and complexity of procurement of one product with one back end is huge. All of the data, and privacy things that you have to go through. So our model has been very much like, get the infrastructure in there, and then you can just license Frank's app. You can just license someone else's app, put it on your existing infrastructure, send it straight out. And we think that's a big part of unblocking the problem. I'll also just touch on what you mentioned before, Peter, about there are all these things out there that are built. We also have an attitude that we're never going to try and do everything in Cogniss. We know what we're good at, which is the sort of content and behavior change and the personalization. And then we just have something called Partnerplace, which is very similar to the sort of marketplaces you have in things like HubSpot and Salesforce, where we have all these third-party solutions and we just have wrappers for them. So, if you want to do certain types of communications, there are people who have built tools for health systems specifically to do that. We're never going to do that as well as them. So it's much easier just to have a little plug-in, and you can plug in their system. We're not going to put a telehealth system in. You can plug your existing one in, or if you're doing something more bespoke, you can just plug Zoom or something like that in and Calendly if you want to. So, we're not reinventing the wheel ourselves, because we know we'll never do as good a job. And you also need that flexibility going into a health system. For instance, let's say there needs to be a booking solution linked to the digital therapeutic. You can't build one into your app because everyone has a booking system already. So they need to be able to customize the solution and drop their booking system in or their telehealth system in.
Oh man, I'm resonating so much with you'd want that foundation, because that's the worst when you've built something out from scratch and then you don't think about all of the things you kind of just need to keep across. And what I love working with, like even outside of healthcare, you've got your booking specialists and you've got your landing page specialists, but they're all teams that are kind of building out and continually evolving their products. And then if something comes up that you're like, oh, that's interesting. But then if you haven't got that foundation that allows you to plug things in and out and move, then you kind of are stuck with this old thing that you built that was cool 2 years ago, but it's not fit for purpose as much anymore. And I'm thinking too, because I know earlier Frank mentioned that, look, in mental health, there's a lot of similarities and other parts and things that we need. And you kind of alluded to it already, Leon, but like, where are you seeing the strongest potential for predictive tools in healthcare to be used?
Yeah, well, from my angle, of course, I get to see the people who are coming to us who are working on grants, who are thinking about things that they want to do in the future. And there are already, other really interesting products being built on Cogniss too. And one that parallels the solution that Frank is building, but for a completely different purpose, is a product called Wearables being built, or it's actually being built and now going into testing by Murdoch Children's Research Institute. And this is a product for children with cancer to predict incidence of sepsis. And basically, I use that, plug in the Brain and Mind Center funded us building, and they collect health kit data from an Apple Watch that the child wears when the child goes home. And then basically they're able to predict a sepsis event before it occurs and alert the parent, and the parent can get the child to hospital. So, again, interesting how totally different application, but basically exactly the same kind of model being deployed. And we've got people at the moment talking about things like autoimmune relapse. As someone who lives with an autoimmune condition myself, that's in that is asymptomatic at the moment, I know that with my particular condition, if the symptoms return, the sooner that there's an intervention, the less chance there is that it's going to develop into something more serious. And so being able to monitor and know when those things are going to happen is really important. With degenerative conditions, we've got a researcher at the moment, I think, has got a grant in around cystic fibrosis. Again, looking at those symptoms to predict when there might be some kind of degradation happening and intervening before that happens. I'm also kind of really interested in the application of these things around age-related conditions. 70% of people die from age-related conditions, and knowing what the progression is towards things like dementia and being able to step in early makes an absolutely huge difference.
And so, Frank, youth mental health, tell me a little bit more about that problem, why it's such a priority.
Yeah, I mean, youth mental health is such a priority because most major mental disorders like depression or bipolar disorder, they emerge in first, and 75% emerge before the age of 25. So it's a critical period when most things emerge. And it makes sense. I mean, there's a lot of neurodevelopmentally and biologically, there's huge development going on at that period of time, while there's also major social change going on, transitions from, say, really structured environments at school to then independence. And so, a lot can go wrong in that period. And we know that the onset of a disorder during this period can have huge long-term impacts, because you can imagine, someone having kind of years or really vital years of learning at university or school can be really disrupted, which can lead to long-term effects on their ability to earn in the future. And we know that these conditions are chronic. So, they can lead to not just chronic mental health problems, but physical health problems as well. And we know that comorbidity is huge as well. And so it's a period of time when a lot is going on, but it's also a time when, because it is early in the stage of illness or early in the course, we have the potential to make a real difference. And so the focus on indicated prevention and early intervention, getting in early before things get worse, can offer us really huge gains in terms of changing the kind of life trajectories of many people. And then youth mental health is now being complicated by, as everyone on everyone's mind, in terms of social media and AI and other kinds of technologies and the impacts on people's kind of behavior and their mental health and their development. So that's added a whole nother layer of complexity to an already really complex period in life.
No, it's not getting easier, is it? But that's a challenge. And the bit I often reflect on too, Leon, is it sounds like we've got all of the answers in theory, so to speak, on how to address these things, but they're obviously still very big issues. So I don't think we're really nailing this whole let's do predictive healthcare at scale thing. Like, why is it so hard to do at scale?
It's the same underlying issue that we have with patient-facing digital health support products and digital therapeutics generally, and it's the multiple. There are multiple difficulties for health systems in rolling these things out. From the procurement point of view, as we've already touched on, very hard for them to procure point solutions. There is no one in charge of procuring these solutions. There isn't someone that you can go to in a particular local health district and say, you're the person in charge of buying youth mental health products or irritable bowel syndrome products, or, they're just, those things aren't.
That would be a very long title on the job, on the business card. But
And budgets aren't there. So it's really interesting whether you look at the priorities of the Federal Health Department in Australia, or you look at the NHS 10-year plan, or, Singapore's the other market that we work in, and you look at the policies of the government there. Everyone is talking about the role of digital products in keeping people well and keeping people out of the health system. And yet we have a culture in the health system that you touched on before, Pete, which is driven by history and the nature of the way things work, that we treat disease. We don't have those ways at the moment of really trying to deliver preventative healthcare. And it's very hard for people in systems where they're under-resourced, they don't have enough money to lift their head above the parapet and think about the future. They've just got to respond to today. So we've been thinking about this for years, working in 3 different markets, understanding the similarities and differences of how health systems work and how to solve those problems. And we feel that the only way to solve it is to have these common infrastructures like Cogniss. Ultimately, obviously, other people will emerge doing similar things that allow a system put into one infrastructure that they can then deliver multiple products through, where they can have one super app for you as a patient. So you're not downloading all these apps, where you've got control of your data. You can determine how the data is shared and have a personalized health experience. But there's another problem on top of that, which is there needs to be a way of mapping demand to supply. So at the moment, we work with lots of people running innovation programs, clinical entrepreneurial programs in the UK and things of that nature. And it's very much an innovator comes up with an idea and comes into one of those programs, or a researcher has an idea of what they want to research. They go get a grant, they build a product, but there's very poor matching with what health providers are seeing as their number one problem that they want to solve now. And I saw a LinkedIn post from someone in the industry the other day saying, if you're not thinking about what the top 3 problems are for the health system that you're talking to, you're wasting your time. And that's kind of true. So where we are moving to is more of a publishing model, where we have a marketplace, and we think we're going to actually build out a publishing business next year that actually works with people like Frank to say, this is actually what a health system wants to put out there. So how can we work with you to build a great research product that has a direct path to market? And this is also what we're doing with Ripple. So for those who don't know, for the last couple of years, we've run with Talking HealthTech and other partners something called the Priority Population Digital Health Challenge. And that was a really successful competition where we just went out to the world and said, if you've got a product that you want to create for a priority population, so a population that is underserved by the existing health system, enter this competition. We'll pick 2. We'll support the creation and commercialization of those products. And there was such a great response, we've turned that into this thing called Ripple, which is now a rolling set of competitions that we run globally that look at particular areas that are underserved. And rather than just having 2 winners, we're also supporting a cohort of creators in that space, because we feel to go and talk to a health system about a particular problem, say youth mental health, it's not enough to have a great product like Mind in Your Mind. You need a suite of products for different, severe enduring mental health conditions and other things that are out there. And so at the moment, we're running the first of these ripples, which is focusing on women's health, because women's health you go around the world, and most health systems identify this as a top priority where there are very large inequities. And it was interesting running this competition focused on one area. We got about twice as many entries as we did running something that was open to everything, because people concerned about this issue, kind of went viral amongst them. And we're going through the judging process now, but it's wonderful. Hopefully this will drive the creation of 10 or 15 women's health products. And there's already 5 or 6 really good evidence-backed women's health products on Cogniss. And then we can work collectively with those people to go to a health system and say, okay, here's 20 things that will support women through their entire life with all of these common issues and niche and rare issues. And youth mental health is probably, we think, the second biggest global priority. So we're looking at our calendar for events next year, but our thinking at this stage is that youth mental health will be the next ripple that we run, so that we can again have a kind of digital formulary of a catalogue of products in this space and help the best experts create those and commercialize them.
Love it. Look, good little set of things and ways to address problems, and cool programs that, we're looking forward to continuing to support through Talking Health Tech as well. Of course, the details for Cogniss are in the show notes of this episode and on our website too, as THT Plus Company Partners. So do check that out if you're keen to connect and learn more. But Frank, Leon, I really appreciate making the time to talk about this conversation, and looking forward to doing it again soon. Thank you so much.
Thank you. An absolute pleasure, Pete.
Yeah, thanks for having me.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.